Hi, I'm Dr. Josh Bletzinger, and in this thyroid video, I'm going to discuss and examine the current medical model and its treatment and management on thyroid conditions, as well as many other chronic conditions. And so if we talk about the previous video, talking about stacking up these quintessential symptoms of hypothyroidism and visiting your doctor and knowing that it doesn't take a rocket scientist to understand that you might be dealing with a low functioning thyroid. And in fact, you do go out and get those blood labs and it demonstrates that you have a low functioning thyroid, that you're being managed just based on a few different markers, which is TSH, maybe T4. So we talked about that there's 10 markers in the thyroid system, and typically 2 to 3 of those markers are being evaluated on a consistent basis. So we're being underdiagnosed because out of the 10 markers, there could be 20 different combinations: underconversion, overconversion, thyroid resistance, pituitary problems, you name it. So we're being underdiagnosed and we're being treated and managed on 2 or 3 of those markers. Not to mention that thyroid conditions can be mimicked by many other conditions in the body that would represent a sluggish metabolism. But the number one overall, 90% of all cases are because of an underlying autoimmune condition called Hashimoto's. And so even if we're getting all of those evaluated and diagnosed, when the disorder progresses long enough, TSH is ultimately going to rise. So when you go out and you get that blood lab and the TSH is high, it's like, we've got it. We found exactly what's going on and we're going to treat that. And so what that looks like here, the question I always ask, what came first, the chicken or the egg? And it's going to be, in the medical model, it's going to be the chicken all the time because it's right in front of you. It can be identified. You see it, so you're going to treat it. My question is did you get sick from a malfunctioning thyroid, or did your thyroid malfunction because you were sick? Always want to answer that question, because what came first, the chicken or the egg? So getting back to the story, you go out, you get your blood labs, the TSH comes back out of range, out of reference range. Hey, your TSH is high. We found it. We got it, and we are going to treat it. And it's like, hallelujah, thank God, this is going to be my savior. And so what happens in that model, the doctor offers you the solution. The solution, Synthroid or levothyroxine. These medications are designed to give you synthetic T4 in your body so you can lower your thyroid stimulating hormone levels. We got it. We did the job. Take your medication. Come back and see me in 3 months, and ultimately we're going to see what your blood labs look like. So you go for that 3 months, maybe you're dancing the jig, things might be feeling good, and when you get back into your doctor's office and they rerun the labs, guess what? Great news. Your labs are normal. We did it. We found it. We brought down your TSH. And so what happens at that point is, by the way, because we got it, and everything is in normal range, how long do you have to take those medications? For the rest of your life. That's right, for the rest of your life. But here's the problem. As time goes on, you start to reoccur the symptoms. This isn't working anymore. I'm feeling like crap. Things aren't going right. I thought I was supposed to feel better on these medications, but nothing's changing. So every time you go back to the doctor, they're either readjusting your medications or they're telling you, hey, your labs are in normal range. But wait a second, doc, I'm still having symptoms. Something is still wrong. I don't know. Everything that we see here is showing that the medication is working and that your labs are within range. So it must be from something else. So we start the blame game. And the blame game, if it's your depression, you're gonna blame it on being a couch potato or not doing things. If you're gaining weight, well, you better diet and exercise so you start losing weight. You see what I'm saying? If there's all these different symptoms that are popping up, then all of a sudden we're going to start pointing to those symptoms and saying that you've got to do something about your symptoms. Because the labs are normal, because the Synthroid or the levothyroxine is doing the job, and all of a sudden labs are normal and we're still having symptoms. And as you go forward then, as we blame this on everything else, we're going to get a pill for every ill. The cholesterol starts going up, let's take a statin. The blood pressure starts going up, let's take a blood pressure pill, okay? You get anxious, you get depressed, let's take anti-anxiety pills. Let's take antidepressant pills. I can't sleep, let's take sleeping pills. And the list goes on and on and on, and you just go, every time that merry-go-round comes around, every time you go, you get a pill for every ill because you're trying to chase down a symptom. But yet, you're on levothyroxine, your thyroid stimulating hormone is normal, and if it does shade out of range, either high or low, we're going to just adjust that thyroid medication. We're just going to adjust the levo and to get that back into normal range. So now you're symptom chasing, you have a pill for every ill, and still nothing symptomatically is getting better. You're gaining weight, you can't sleep, your hair is falling out. It still continues to go in that way. And that's this roller coaster that you ride. There are bouts of energy and wellness, and those are met with, periods of depression and not feeling well and illness. And so you go on this wonky roller coaster year after year, day after day. So what I'm here to offer you and what I'm here to show you is that if we're continuing to work in the standard medical model on trying to beat down the symptoms, chase these symptoms using a pill for every ill, and ultimately trying to, pass the buck on every symptom, it's because of this, it's because of that. This medical model is designed on a monomechanistic disorder. It's your TSH. It's your cholesterol. It's because you're overweight. But little do they know, and where we've gone with this, is that treating a thyroid is not treating a thyroid under a monomechanistic disorder, but looking through the lens of saying that this is a multifactorial disease process. And so here's what I mean about this situation. The thyroid gland, the thyroid system can have many, many triggers, especially if there is an underlying Hashimoto's condition. Because like I said at the beginning, treating the thyroid just to treat the thyroid and drive down the TSH is doing absolutely nothing to going after the triggers or the causative factors to why the thyroid is not working in the first place. Is my thyroid malfunctioning because I'm sick, or did I get sick because my thyroid is malfunctioning? So you can see here just some of the basic components and triggers to why a thyroid system might go out of whack. Genetic polymorphisms at the vitamin D receptor site, insulin surges, whether we're starting to create diabetic processes and we have dysglycemia, so hyperglycemia, hypoglycemia, estrogen surges, so hormonal dominance through estrogen, intestinal permeabilities, so gut problems. We're looking at blood-brain barrier problems. Coincidentally, the barrier that protects our brain is the same exact barrier that is between our gut and our system, all right? Toxicity, so biotoxins, and not just limited to metals, but we're looking at molds, we're looking at viruses, we're looking at bacterias. So those are through subclinical infections. Food tolerances. Have you ever been tested, and not from an allergic standpoint, but from an immune standpoint, on what your body it doesn't like as far as foods, what creates the inflammatory process? Gluten intolerance. Iodine exposure, okay? If you're taking iodine on Hashimoto's, you're pouring gasoline on the fire. Pregnancies, any sorts of stress, physical, chemical, mental stresses, the imbalance in your immune system, cytokines, so inflammatory elevations, and ultimately gene susceptibility, because if this is an underlying Hashimoto's condition, it is familial, it is in the genetics and can be passed down through your genes. All right, so when you look at a multifactorial disease process, there's many, many triggers that can be influencing the way that your body is functioning and making your immune system aggressive against your thyroid tissue. And so the days of a monomechanistic disorder, we're going to chase this down with levo, and we're going to give you a pill for every ill, and we're going to pass the blame on every other problem, is not going to get the job done. And so in a functional medicine model, in a model that I have a philosophy in and that is working so well for my patients is we're not going to go after the disease processes. We're not going to put a label on a disease and just treat it as a label of disease. We're going to open up the hood. We're going to turn you over. We're going to shake you out, and we're going to find out all of the causative factors. We're going to look into all the different body systems. Cells make up organs, or organs make up system. So we have to look for dysfunction. We have to look at functional compromise within these systems. It doesn't mean it's diseased. It doesn't mean that your liver is diseased. It just doesn't mean that it's functioning correctly. And we have to figure out where and why something is not functioning correctly and restore function. So when we find the disorders, we have to treat those correctly in order for the function to improve. When you have cellular improvement in function, when you have organ and system function, functional improvement, your metabolism normalizes, your body balances itself. You have the innate ability to do that. And so if you look and you compare and contrast the two models that we have available to us, the traditional model, the standardized medical model, is designed on pathology reaction. I have symptoms, they're not right, I'm going to go see the doctor. The doctor is going to evaluate me, he's going to use laboratories, and those lab results are either going to be in normal ranges or they're going to be out of normal ranges. If we can label that condition with a diagnosis and treat that diagnosis, that label with a medication, that's the standard of care. And ultimately, the outcome of that is to control the signs and the symptoms, is to manage that situation. On the flip side, the contrast in the functional medicine model that is proven to do so darn well with these patients, looking at multifactorial processes, it's individualized care, it's customized, and it's understanding your baseline. It's understanding your systems, your biochemistry, and understanding where the causative factors are coming from. So this is systems identification. It's not pathology reaction. And we're going to be proactive in this situation because we're going to be looking for the causative factors. Okay, the treatment system is to ultimately pull these labs into optimal range, but also to compare against your baseline. How are you functioning? How are you maneuvering? I'm biohacking you. I'm understanding exactly how you're progressing. Okay, we're using the body's innate ability to heal. Okay, no body wants to work wrong. So when we give it the right materials, because no body system, no body system uses anything but nutrients to improve itself and to function correctly. So we're using natural means. We're using the right supplementation. We're using the right macronutrition. It's not dieting, by the way. It's healthful eating. And we're changing aspects in your lifestyle. We're enabling your body to arrest the dysfunction, and you're allowing your body to innately heal, given its ability to do that, so you can improve. And ultimately what we're looking for is we're looking to optimize function. So we're not chasing down the symptoms, and we're creating vitality. We're creating life in your years, and we're getting your systems balanced so you can suppress those symptoms and you can go on about your daily activities with energy and vigor and life. And it's just a really cool process. So the difference here is that we're not chasing symptoms, we're improving function, we're not going after a monomechanistic disorder, we're going after a multifactorial disease process, and we're helping you improve on your goals and your needs. So I'll talk to you soon. We'll move on to the next strategy here. Enjoy the rest of your day, and I'll see you.